so now I'm going to demonstrate giving an IV bolus. So the first thing I'm going to do is I'm going to go to my MAR and I'm going to get the medication out of the cabinet. I'm going to check, okay, so my patient is going to be receiving morphine, so I'm going to look, make sure, yes, this is morphine, and make sure it's the right concentration. So I see that my patient is going to be receiving 2 milligrams of morphine, and it comes in a vial, 1 milligram per milliliter, so I'm going to be drawing up 2 milliliters, okay? And since these are single dose vials, I'm going to drop all the medication that's in it, and if there's more than what I need, I have to have another nurse witness my wasting of the medication because it is a Schedule II. So I'm going to check for the first time, yes, this is morphine, the right concentration and everything. And while I'm here, I'm going to pull out my drug guide, I'm going to look at morphine, I'm going to check the rate it's supposed to be given at. I'm going to be checking the concentration, whether or not it needs to be diluted. I'm going to be checking the compatibility with any IV fluids that are already infusing. So I'm also going to be checking to make sure the patient doesn't have any allergies, checking to make sure they don't have any medication interactions, things like that. So I'm also going to check the expiration date. There's a lot to check. So then I've done all that, I am going to prepare to go into the room and administer the medication. So, knock, knock, knock. Hi, my name is Dusty. I'm going to be a student nurse today. Can I get your name and date of birth? Thank you. Do you have any allergies that I need to be aware of? Hopefully they say no. So then I am going to tell them that I'm here to give them an IV bolus of morphine. I'm going to tell them that morphine is to help with them with their pain. It is a narcotic, so they might experience some constipation, some drowsiness, some sedation, those types of things. So I'll let them know those are things that they should expect. This is not something that I'm going to communicate to my patient, but something that I need to be aware of with morphine is respiratory depression. So if it gets below 10, I know in the hospital I have a patient and they have Narcan ordered, like a continuous order, and if the respirations get below 10 breaths per minute, you administer the Narcan. So that's something I want to do, is I want to have Narcan available if anything, if they experience respiratory depression. So I'm going to go ahead and let the patient know I'm going to go ahead and start their infusion. So I've got my supplies, I'm going to perform hand hygiene and put gloves on. I'm going to go ahead and check their IV site and make sure that it's patent. I see that they already have sodium chloride infusing, and that's something that I noted on their MAR whenever I was getting the medication out of the cabinet, and it is compatible, so that's good. And I'm going to make sure there's no infiltration or anything at the IV site and check for those types of things. So I'm going to go ahead and get my medication and check for the second time, yes, morphine. I'm going to check all my 6 rights of medication administration. And I know I'm going to be drawing up 2 milligrams, and I noticed in my drug guide that it doesn't need to be diluted, so I'm going to dilute it in 5 milliliters of normal saline. So I'm going to go ahead and get just 5 in there. Okay, so that is ready. And then I am going to get ready to drop my medication. I'm going to clean it for 30 seconds. And then I'm going to go ahead and get my syringe and my needle ready. Okay. And like I said, I'm going to make sure once again, yes, I'm going to be getting out 2 milliliters of this morphine. And like I said, I'd have to have another nurse witness my wasting of it since I have to draw it all up. Okay, I'm getting my 2 milliliters out. Okay, make sure I'm going to get all the air bubbles out, that way I don't have to inject them into the thing later. Okay, and so I've got my flush ready. I'm going to go ahead and pull it up to 7. I'm going to go ahead and inject my morphine in there. Okay. Alright, so then I'm going to recap my needle. Usually in the hospital they have safety devices, so that'd be a lot easier in the hospital. Okay, I'm going to go ahead and mix this. I don't want to shake it or anything, but just gently mixing it. Make sure I get all the air out. Okay. Since there is normal saline already infusing, I don't need to flush it, but if it were a hep lock or a saline lock, it would be really important for me to go ahead and do like a 5 milliliter flush to make sure I get any previous medications out of the line. So, like I said, theoretically I would go ahead and clean the port with a hep lock or saline lock, and I would flush it, but since this is already infusing, I'm just going to go ahead and clamp it. I'm going to get a new alcohol wipe, and I'm going to go ahead and clean it for 30 seconds. And I'm going to go ahead and, since my drug guide told me I need to infuse this morphine over 5 minutes, I'm going to go ahead and infuse it really slowly over 5 minutes, but not for real. In real life I would, but since right now we're in the videos, I'm not going to do that. So, like I said, I will have been infusing this over 5 minutes, and whenever I'm done, I'm going to get my saline flush, and I'm going to go ahead and flush it, and then I'm going to let it flow again. I guess I don't really need to flush. Oh no, I do need to flush it. It's really important to flush it because I need to flush it over 5 minutes, the same as the morphine. So that is really important, sorry. So like I said, get my flush. I'm going to flush it over 5 minutes, the same rate that I administered the medication. And then I can unclamp it and let it go. And like I said, I'll let the patient know, once again, you might feel tired, that's normal. I'm going to keep checking on you, and I'm going to be in, and here's your call light. If you need to holler at me, just holler at me, and like I said, make sure the call light's in reach, and I'll be back soon. Okay, I'm going to demonstrate how to give an IV piggyback. So the first thing I'm going to do is I'm going to go to my MAR, and I'm going to go and get my medication. So I'm going to look at my MAR for the first time. I'm going to check to make sure, yes, I'm going to be giving levofloxacin, 500 milligrams. I'm going to compare this with the doctor's order since this is the first time I'm giving it. So yes, levofloxacin, 500 milligrams, give over 60 minutes. I'm going to go ahead and check with my medication administration book, make sure that that it is compatible with the IV fluids the patient's on. I'm going to make sure that yes, it's appropriate to give it over 60 minutes, and I'm going to check things like that, make sure the concentration's good and everything. So those are the things I'm going to check. I'm also going to check on the medication, make sure it's not expired. I'm also going to check on my patient's allergies, make sure they're not allergic to the fluoroquinolones or whatnot. This is levofloxacin. So after I've done that, I'm going to go ahead and gather my supplies and get ready to go into the room. So, knock, knock, knock. Hi, my name's Dusty. I'm going to be your student nurse today. Can I get your name and date of birth? Thank you. Do you have any allergies that I need to be aware of? And if they tell me, hopefully they're not allergic to fluoroquinolones or levofloxacin or anything, so that would be good. And I'm going to tell them that I'm here to give them levofloxacin, that it's an antibiotic, and it's an IV piggyback, so it's going to hook up to the IV they already have. It's going to infuse over about an hour, so they can expect, to have that infusing over the hour. I'm going to tell them that some side effects, an adverse reaction to antibiotics is often a allergic reaction. So I'm going to tell them things that they would like, that I would need them to make me aware of, is if they experience any itching, rashes, hives, any difficulty breathing, and those types of things. And I'm going to again make sure they understand that the antibiotic is to help with their infection. So I'm going to go ahead, and as long as they don't have any other questions, I'm going to perform my hand hygiene and put my gloves on. And since I've already identified them with 2 identifiers, that's good. And I'm going to go ahead and check, since I'm at the bedside, I'm going to check for the second time. Yes, levofloxacin, 500 milligrams, give over 60 minutes. I'm going to check all my patient rights, the 6 rights of medication administration. And I'm going to go ahead and prepare to hook it up. So I'm going to first drop my normal saline. And then I'm going to get my secondary tubing. And as I am spiking my bag, I'm going to check for the 3rd time, make sure my patient medication rights of administration, make sure they're all good. So then I'm going to go ahead and spike my bag. And I got to make sure that this is sterile, so I don't want to touch it to anything. Okay, and it is clamped, so I'm going to find the port closest to the IV bag. Here it is. I'm going to clean it for 30 seconds. I'm not gonna clean it for 30 seconds in this video, Holly. Just talking to you in the video. Okay, and I'm gonna go ahead and hook this up. And I do have my primary tubing clamped. So now I'm going to take this and unclamp it and drop it below so I can go ahead and prime that tubing. Okay, now that I've done that, I'm going to go ahead and hang it. And I'm going to, of course, the biggest thing, one of the biggest things before I'm doing all this and before I go ahead and push this through, since the normal saline's already going through, my IV should be patent. But I'm going to look for infiltration, look for any coolness or any problems like that. So since I am sure that everything is good, I'm going to go ahead and start calculating my drip rate. And since I've already performed my calculations, that's something that I did whenever I got the medication out. And so I have 125 milliliters to infuse. So that's going to go over an hour, and my secondary drop factor is 10 drops per milliliter. So that ends up being that I'm going to need 3 drops, 1 drop per 3 seconds, and 5 drops for 15 seconds. So I'm going to go ahead and start calculating that.
And then we go ahead and
it should start to flip, and then that's how I control how many drops go in and whatnot. And then once I have that infusing, make sure that she feels it safe.
So there my drops go. I was getting a little worried there. I'm going to go ahead and count for 15 seconds. Make sure I've got my 5 drops. Alright, so I've got my drop rate calculated and everything's infusing well. I'm going to let the patient know that I'm going to be back here pretty soon to check on them, and once again, just let them know, just hit the call light button. I'm going to make sure it's in reach and let them know to just holler at me if they have any adverse reactions, and I'll keep an eye on them.